This is group 3, and we will be talking about Cluttering Update, an article by San Luis. We will be talking about what type of publication, what was covered, a brief summary, including the evaluation, the treatment, and also how can we apply this to a clinical setting.
We were assigned an editorial because it provides non-biased and non-opinionated information on a specific topic. Also within the editorial, it includes ads such as an ASHA product or a device that would be beneficial for clients to try. Our article discusses cluttering in different aspects, such as how it may be identified and defined as a fast rate of speech delivery, which can be irregularly fast, abnormal, or both. And it may include disfluencies and its difficulty in evaluation and individualized treatment. This difficulty occurs due to a lack of research and understanding of its true symptoms and definition, as well as its relationship and coexistence with stuttering.
The first part of the editorial talks about identifying, which can be difficult because there are some issues that make it challenging to diagnose. People who clutter do not frequently clutter when speaking in short evaluations, so this may lead to the patient not being diagnosed with cluttering and only relying on one subjective account. Another problem is that language planning and pragmatic problems are taken into account in the diagnosis for cluttering, but language difficulties are not included in the definition of cluttering because some people don't show evidence of language problems. Another issue is that people clump cluttering and stuttering together, which may confuse people with each disorder, causing it challenging to identify the cluttering.
Another portion that this article focused on was evaluating cluttering. Just like stuttering, it can be difficult at times to evaluate cluttering. Most importantly, first off, is getting that case history to understand if there's any coexistence with this other disorders or disabilities like learning disabilities, auditory processing disorder, or attention deficit hyperactivity disorder, which is known as ADHD. There were no norms previously established, so it may be challenging to measure. However, the SPM, which is syllables per minute, is most commonly used to measure and determine a person who does clutter. And it measures their conversational rate when they speak. Along with that, you want to do a questionnaire to see the severity that that client may be suffering with their stuttering. And the clinician can also do a checklist for possible cluttering just to alert them, the clinician, how many symptoms that that client is showcasing.
Another portion that this article summarizes is the treatment part. In order to provide the best care for the clients, the therapy should be individualized and tailored to each person's differences. The article focuses on some common goals for cluttering treatment. For example, slowing rate, which you could use delayed auditory feedback, heightening monitoring, which you could do using video, audio, tape conversations to identify places where monitoring seems to be broken down. Also, you could use using clear articulation. The client can practice short sentences to elicit the best mix of unclear clutter speech versus correct, but over-articulated and unnatural speech. You could also do using acceptable organized language. Have the client repeat what they are saying with only useful information. Interacting with listeners is another option. This will allow clusters to practice anticipating, perceiving, and responding to standard cues in conversation. Also, you could do speaking naturally. SLPs can teach their clients to vary syllable duration and intonation contours. And finally, reducing excessive disfluency, which fluency shaping strategies can reduce the occurrence of disfluencies.
As we have learned, the most effective way to help treat our patients is to use evidence-based practice. This editorial will serve as the basis of all the main points we need to know about cluttering. As SLPs, we will encounter many people who either clutter, stutter, or do both, and this editorial can serve as a reliable source to come back to when trying to figure out how to tell the two apart. The 3 main topics covered goes over much of what we will need to know, and this editorial can constantly be referenced in the future if we have any general questions about cluttering to ensure we are implementing the best evidence-based practice available.